Testing for the coronavirus is an essential tool in the fight against the spread of COVID-19. More and more testing these days is being done not by public health agencies, but by private companies. That allows some businesses, even entire industries, to remain working. Well, there are questions about how the private tests are regulated, the oversight or lack thereof. So this morning, the details on a CBC News investigation. Albert Leung is with us from Toronto, part of a team looking into this. Good morning, Albert. Tell us more about what you were looking at and what you found.
A very good morning to you, Heather. Well, in the past couple of months, countless private companies have emerged offering COVID-19 PCR tests. And look, they're in high demand. Initially, they were taking pressure off the public system. Now they're being used more and more to keep businesses open. Think essential businesses who need them to do on-site testing of employees everywhere from film sets, food processing plants, airports, as well. Some are relying on private tests so they can safely enter personal care homes to visit family. And just to give you an idea, the price of these private tests range anywhere from $160 all the way up to $400 each.
So the price tag has been an issue as we've started to hear about that. But the other part of the equation is oversight, or as I mentioned, lack thereof. Who's in charge, Albert, of all of these private testing companies?
Well, no one. And that's got some people very concerned. Private testing is a largely unregulated industry. There's no central licensing body. Now, companies can only use tests approved by Health Canada, but the rules about training, for instance, differ from province to province. What's important is that companies are required to report any positive tests. But we found in many provinces, no one is actually tracking how many tests are being done by private companies. And that is so important because it can affect the positivity rate, which is often relied on to figure out where outbreaks might be happening. I'm going to share a clip with you.
I think that all these companies really should be reporting to one organization or an umbrella organization. But when you have people working independently in no man's land, then you really don't know, are the tests accurate and are they doing the right infection control if there's a lot of money to be made. And so I think that there needs to be a body that has some oversight.
Dr. Banerjee goes on to make the point that there's a lot of money to be made in private testing. And while companies aren't willing to tell us how much, we found 16 companies in the testing business across Canada, many of them very new. Just to give you an example, we found a couple of blood clinics that pivoted to COVID testing mid-pandemic. Another one that was essentially a gym before launching its COVID testing operation just after the holidays. And these companies are getting contracts to do testing several times a week, sometimes for several hundred employees. And across Canada, that's working out to many thousands of COVID-19 tests every month now being done by private companies.
Albert, thank you very much. Albert Leung is in Toronto, part of a team that has been doing additional reporting. We should mention, Albert, online at CBCNews.ca. There's more there if people want to do further reading on this issue. Thank you, Albert.